Okay, so Dr. Miller, tell me your connection with the Courage Ride and what you do.
Yeah, so I'm an orthopedic oncologist. So I'm an orthopedic surgeon that takes care of tumors of all kinds, and one of the main things we take care of is sarcoma. And so I'm really involved with the Courage Ride, certainly by necessity or obviousness, just because sarcoma is one of the main cancers that I treat, and Courage Ride supports sarcoma here at Iowa. I'm 10 years now at the university this summer. So I've been here 10 years, and the Courage Ride is been here longer than I have. So I've been involved with the Courage Ride since the time I've started. And initially it was just kind of, as a participant and somebody who benefited from it. And over the last few years, I've worked closer and closer with the Courage Ride board and really gotten to know them and gotten to see the ride evolve into what it is today, which is great.
Yeah, that's cool. Okay, so I've interviewed a bunch of people regarding the Courage Ride, and we talk about sarcoma cancer research, and we talk about the Courage Ride. But I'm wondering if there's people like me that never thinks to stop to ask the question, what is sarcoma cancer, and how is it different than other cancers, and how does it affect the body?
Yeah, sure. Yeah, that's a great question. So it is a cancer. So, you can certainly just think of it in some ways as any other cancer. It's something that's in your body that's growing that shouldn't be there. And if it grows too long unchecked, then it kind of takes over your body. And that's cancer is, so sarcoma is unique for a number of reasons. One, the most obvious thing is it's unique because of its rarity, which is something that's a little bit counterintuitive because sarcoma comes from bones and muscles. And when you think of a human being physically, that's what you think of mostly. Like, if you step on a scale, you're mostly muscle and you're mostly bone and you're mostly fat and all these other things. And that's where sarcomas show up. And that's the tissue that it's derived from, but it doesn't happen as commonly as other tumors. So the biggest thing that distinguishes sarcoma is its rarity. So sarcoma as a tumor is, I'm sure you've heard this stat before, it's less than 1% of all cancer. And so that means a couple things. It means, number one, the public health outcry to cure sarcoma is not there like it is for breast cancer, lung cancer. So it's a little bit of a forgotten cancer in that respect. And the other, and one of the things that I think the Courage Ride does really well is it's unheard of. It's people are unaware of it. So when people hear, when I diagnose a patient with sarcoma, oftentimes it's the first time they're even hearing that sarcoma is a thing, and you kind of have to go through this explanation of what is it. Another thing that's unique about sarcoma is it affects all age groups. So when you think of other cancers, prostate cancer, you don't hear of like a 12-year-old boy getting prostate cancer, right? You don't hear of a 12-year-old girl getting breast cancer. But children and adolescents are one of the bigger categories of people that suffer from sarcoma. So there's a lot of older people, older adults too, and just the older you get, the more likely you are to develop cancer of all kinds. But we certainly have the challenge and the pleasure of being able to help people that are kids and adolescents and young adults and getting through really different periods of time in their life. So it's interesting from my perspective because, I take care of people where I can identify as a parent, and I take care of people who I can identify as myself, and I take care of people who I can identify as a parent or a grandparent.
Yeah.
So it kind of hits the whole spectrum of the human condition. And then, the last thing that's a little bit different about sarcoma is the treatment of it, for the most part, has remained very similar for the last several decades. So if you think of all the advances that have happened in other cancers and cancers to some extent that have become curable, that were not curable before, sarcoma has not seen the same success. That really the way that we treat sarcoma is we identify it and then we try to remove it surgically and hope that it hasn't spread by that time. And if it's spread, then it's a problem and it's a challenge. And so part of, what we're trying to do in research is figure out newer treatments or newer biologic pathways or genetic pathways that we can take advantage of that potentially would identify some new treatments. So it's not that we haven't worked hard. We, as the greater, sarcoma community or community of healthcare providers, we're working really, really hard to try to figure out how to cure sarcoma. Has just been elusive. And that's part of the uniqueness of sarcoma too, is it's not just one disease. Sarcoma is very, very different, even within individual tumors. You'll see parts of it that you can even tell on the MRI or after you take them out physically and cut them up, that there are parts that are just totally different than one another. So we're not going to have one kind of magic bullet approach that cures all of sarcoma forever. So it's really challenging.
Yeah. So it sounds like kind of when it comes to cancer research or treatment advancements, that it requires awareness and funding as part of the piece of the puzzle. And so I imagine that the Courage Ride plays a significant role for that, for you all.
Yeah, the Courage Ride, I don't remember the numbers off the bat, but it's, upwards of 80% of all of our funding for research is from the Courage Ride. We have individual donors that come in with specific projects in mind, or specific times where they want to donate, which is great. And the Courage Ride, what that's given us, it's given us a substantial amount of funding, and it's giving us predictability. So we can almost like budget for a Courage Ride donation. And that really helps when we're looking at trying to, make a difference long-term, because it's really hard in the area of academics and the area of research to do, one thing for 3 months and expect to get something out of it. What you need is a research program. You need a plan. You need to be able to hire people, and you need to be able to support a lab. And so the Courage Ride is what we get from the donations that are made during the Courage Ride, really is the lifeblood of our sarcoma research program. Our researchers are, really engaged in we're a bit unique here in Iowa from a sarcoma perspective, because we do have all the pieces in place. So we have all the clinicians that are specialized in sarcoma, which not everybody has. And then we have an amazing number of basic science researchers who are really, their primary interest is in sarcoma, where off the top of my head, even 5 or 6, and I'm probably missing somebody who their primary focus, or at least a majority of their focus, is in sarcoma. And so they're out, writing papers and getting grants and trying to support their own labs and their own careers. But that grant support and that lab support has to come from early ideas and preliminary data. And there's really not a way to support that. There's not a mechanism. You can't ask the government for money because you have a good idea. You ask the government for money when you've proven that your idea is good and it's going to work. So what the Courage Ride has allowed us to do is allowed us to engage with our researchers. It's allowed us to engage with people. We have a collaborator in the engineering college across the river at the University of Iowa. We have collaborations with the veterinary school at Iowa State. And a lot of that is coming from the support that we get from the Courage Ride to say, okay, that sounds like a good idea. Let's dedicate some resources towards it and see where it goes. And potentially it would turn into something bigger.
Yeah, it's really interesting that Courage Ride was started by Jackie Bailey, whose son Seth had passed away from sarcoma and lived in the Iowa City area. And there's all this research and clinicians, as you mentioned, for it right here. Like it's amazing that's kind of all come together in this one place to make such a big impact. So from your perspective, then, doing, I know, clinic hours plus research hours, where do you think it's going? Is headway being made? Are developments being made? How do you see it going forward?
Yeah, I mean, we're always getting better. I think part of it is there's a lot of different categories to getting better at taking care of cancer. And the thing that is the most obvious and the ultimate goal is to eradicate cancer, right? To make cancer like smallpox. It just doesn't exist anymore. And perhaps we'll get there sometime. I personally don't think I'll see it in my lifetime. I think cancer is just when you group it together as a disease process, it's just too complicated. It's not enough like all these cancer subtypes are not like each other enough that there's just going to be one solution to be able to do it. But sarcoma, like I said, we find, our basic scientists are looking for genetic weaknesses in these sarcomas that perhaps would allow us to be able to treat things with newer medications or medications that are repurposed. Maybe they're already used for something else and we can use them for something. Sarcoma, Dr. Manga, I think you're talking with Dr. Manga, right? Either have or will. One of his ideas in clinical trials is a repurposed drug that is used to strengthen bone in osteoporosis and in people with cancer that's spread to bone. But we found with a basic science study that it actually kills a type of sarcoma called chondrosarcoma in lab rats. And so it's a drug that's safe, that we know the side effect profile, and we're just now giving it to people to see if it makes a difference in our treatment of chondrosarcoma, which really has no treatment other than surgery that's effective. So the cure is something that's, it's obvious we're working for. We have a lot of people that are interested in it. But then you have the experience of cancer, and that's a lot of, when I mentioned, younger people get cancer, we have an adult and adolescent and young adult cancer program here called AYA, which identifies the time of life where you're not a little kid and you're not an old person. And there's stresses there. How do you deal with school, or how do you deal with a career? How do you deal with meeting a spouse, or having a job, or having kids? These are pressures that come along with a cancer diagnosis that you don't always think about. And so figuring out how we can make that experience better for the people that have this life-changing event faced at a time where they really need to be productive in life, and they're really figuring out who they are as a person and what they're going to be in reference to a family or a significant other or a career. And then finally, there's the issues of survivorship. And I would say those are the issues that I think of more than the cancer cure, so to speak. I think of how do we do surgery in a way that we can leave more normal tissue, or that people are not going to have the side effects that they have for cancer treatment, or 5 years down the line, we can make the cancer something that's more of a memory than something that's a reminder every day because they have a limp or because they have pain or something like that. So there's a lot of advances that we're making in the world of cancer. If you have a sarcoma today, much better off than you were 10 years ago, probably even 5 years ago, with some of the techniques and imaging and the way we think about things. Even if we can't say, hey, we have a cure for sarcoma, we're certainly treating it better, and people are better off than they were.
Yeah, and that's great, because I imagine you see it all the time, and so you see the folks that are helping the cause through contributions or just through writing. You see the effects of what they're doing on patients and on families.
Yeah, the Courage Ride is great. I mean, it's an interesting time for me in my position. It's kind of a sacred day, the Courage Ride Day. It's a day for laughs and smiles and hugs and fun, but for me, it's also a day to remember the people that we lost. And that is something that is really humbling, and I really take seriously. Not that you need humbling in this business, but it's a good time to sit back and think about those people and the relationships you formed and the sadness they have from it. And really, it's great to see the family members of people that we've lost, just to be able to reconnect, because you really build some pretty close relationships going through these things. And so that's obvious to think, of the people whose outcomes maybe were not as good as we would like, that we want to avoid those things in the future by supporting the Courage Ride. But I always encourage also the patients who have had sarcoma and we've treated them and they're doing great and they feel good and they're happy to be alive and happy to be through it. And I always say, you guys got to come too, because, we hear the sad stories, and it's important to hear the sad stories, but we also have to hear the successes and the good stories, because those are the ones that show us that we're doing the right things, that we can get better at this, and that sarcoma is not always something that stops a life. Sometimes it's just I wouldn't say a little road bump. It's a big bump in the road, but certainly something that you can get past and have a good, healthy, happy, fun, meaningful life afterwards.
Yeah. Well, that's great. Well, thanks for taking the time with us today, Dr. Miller, and thanks for the work that you're doing every day for it. And we appreciate the conversation.